is a presentation on the UMC Health System's blood culture process and timeframes. Just to provide a quick blood culture overview, a blood culture is a microbiological culture of a peripheral blood sample. As blood is usually a sterile environment, culturing can show the presence of a systemic infection. If the culture is positive, the causative microorganism can usually be identified and antibiotic sensitivity testing performed. The UMC Microbiology Lab manages all blood cultures and oversees the process from initial blood draw to results being available for viewing. UMC's blood culture process. After a blood culture is collected, the sample goes through a multi-step process in microbiology before results are ever viewable in PowerChart. Multiple other lab tests may be required based on the initial results of the blood culture. Turnaround result times will vary based off of what microbiology identifies. Step 1 in the blood culture process. First, the blood culture is received by the lab. The sample is then placed in a machine that monitors and scans the blood culture for signs of growth every 10 minutes. The sample will be monitored for up to 5 days. If growth is identified anytime within the 5-day incubation period, an alarm will sound and lab staff will immediately respond. If no growth is identified within the 5-day incubation period, results will show as review until a final report is available. If growth is identified, lab staff will conduct a gram stain on the sample to assist with identifying a causative organism. If growth is identified, this will continue the blood culture process. Step 2 in the blood culture process consists of the gram stain. Please note that gram stains are not performed until after growth in the bottle is identified due to risk of blood culture contamination. The first step in the Step 2 in the blood culture process consists of the gram stain once growth is identified on the initial blood culture. Step 2 in the blood culture process consists of the gram stain. A gram stain is conducted after growth is identified in the blood culture bottle. Once the blood culture growth is identified, the gram stain process will begin. Step 2 in the blood culture process consists of a gram stain. Once blood culture growth is identified, the gram stain process will begin. A sample of blood from the blood culture bottle will be placed on an agar plate manually by a lab tech. Another sample of blood from the blood culture bottle is prepped on a slide and is heat fixed to the slide on a heat block. The slide is then prepped and flooded with multiple reagents to produce the gram stain. Gram positive stains purple and gram negative results will stain pink. Please note that gram stains are not performed until after growth in the blood culture bottle is identified due to risk of blood culture contamination. Based off of the results of the gram stain, it will identify the next pathway of communication of the result. This is a continuation of the gram stain process in regards to communication of results. Results are called to the primary and/or clinic nurse for inpatients and outpatients, or the on-call IP&C nurse for EC discharged patients. Microbiology will enter results into PowerChart and the flow sheet will show a capital POS in red, indicating positive. Preliminary culture results will be viewable. If the patient is an outpatient, results will be viewable in approximately 1 hour of gram stain completion. If the patient is an inpatient, a sepsis PCR will be conducted and the process will continue. Step 3 in the blood culture process consists of the sepsis PCR. The sepsis PCR allows for faster identification of organisms, identifies more bacterial pathogens, replicates DNA to allow for more diverse testing of a small sample, identifies organisms and provides resistance gene detection, and is completed after a gram stain on inpatients only. Once the sepsis PCR is completed, the results flow to the pharmacy to review for potential treatment course changes. Pharmacy reviews the PCR results and notifies the provider of recommended treatment course changes. Please note that this test is only conducted on inpatients, and final results are viewable after approximately 2.5 hours. Other cultures turnaround times. This slide is provided as a reference for other cultures' gram stain turnaround result times. Please note that specimens that are walked down to the microbiology lab are typically provided. Other cultures turnaround times. Other cultures gram stain turnaround result times. Other cultures turnaround times. This slide is provided as a reference for other cultures gram stain turnaround result times. Please note that specimens that are walked down to the microbiology lab typically have a faster turnaround result time than specimens that are sent down to the microbiology lab. A few important notes to keep in mind in the blood culture process. Reports are updated approximately every 18 hours based on identification and susceptibility availability. Once growth is detected, the capital POS in red will remain as the result until the culture is completed. No growth will show as review for 5 days until official results are available. If you have any questions in regards to this presentation, please feel free to contact Pam Kerr at UMC Performance Improvement or Elena Woodward, the manager of the microbiology lab.